Mike LeNoir, and this is the Wellness Watch.
Welcome to the Wellness Watch. I'm your moderator, George Strait. Obesity. Nobody likes to die, but also nobody likes to see those extra ripples around your stomachs and arms and waist. So many of us struggle with our weight, but what can we do about it? And what are the risks if we don't do anything about it? On today's edition of the Wellness Watch, we've got experts with strategies and a person who is meeting the challenge. Our host, Dr. Mike LeNoir, will outline the risks. Monique Pittman is a certified health coach, and she's got strategies to help us lose weight for good. And her client, Sharonda Smith, will also share her journey. So Dr. LeNoir, like we usually do at the beginning of these things, let's talk about the basics. What are the risks with obesity?
Well, I think, certainly the definition of obesity, obviously, is basal metabolic rates, index which are greater than 99%. And probably there's a lot below that. There are about 237 diseases associated with obesity, true obesity. Certainly, the biggest ones are heart disease and diabetes. But we know that obesity is an inflammatory state, so that a lot of inflammatory diseases are aggravated by obesity as well, asthma, arthritis, and some of the others. And so obesity is without question a baseline of pathology that makes it hard for you to stay healthy.
Dr. LeNoir, it seems like what you're saying is that obesity can actually affect absolutely everything about you, both physically and sometimes psychologically too.
Oh, I don't think there's any question that, most people who are obese view it from a kind of a lens of always being concerned about fat shaming, always being concerned about being treated differently because they're overweight. There's no question that there should be health equity for people who are obese because they are treated, I think, very poorly, often by the healthcare system. 74% of medical students think that people are obese simply because they don't know how bad it is. And so consequently, they suffer an awful lot from mentally. Physically, there's no question that inability to move that goes along with a lot of obesity, plus the generalized inflammatory state. And I can't emphasize that enough, that obesity is an inflammatory state. So your body's always churning around, making you susceptible to a number of medical conditions, both short and long term, that are sometimes not reversible after a while.
So, Ms. Pittman, what do we do? Losing weight is difficult, and how difficult, and what's your counsel to your clients, and what's your approach?
So yes, losing weight can be difficult, but as a certified health coach, my approach is really to teach clients that this is a lifestyle change. It's not a diet. And so subsequently, with a lifestyle change, you're looking at not just doing something that someone says, like eating certain food or drinking certain shakes, but you're looking at, first of all, your mindset, your habits, your triggers, how you got to this point in the first place, and what you can do from here on out. And so my approach really is to teach clients that when I'm coaching them, the whole point of my coaching them is for them to learn these habits over time so that they can keep the weight off. You can do anything today. And, there's so many things out there on the market. There's lots of different diet plans. But unless you learn the key habits of health and learn that it's an integrated approach around sleep, around stress management, around hydration, all of those things are key. Unless you learn that, you're just going to put the weight back on. So that's what I share with my clients is this is an overall journey through health. It's not just do this right now and lose weight.
Ms. Smith, talk to us about your journey.
So about 4 years ago, I started with the program that Monique teaches about. So I'm going to talk just a little bit prior to that, because at that time, prior to the program, I was 80 pounds overweight. I was pre-diabetic. And I think a lot of it had to do with just kind of being overwhelmed with life, busy mom, career woman. At the time I was married, I was also a caregiver to my former mother-in-law. So just like a lot of life stresses and kind of dealing with the stresses and with unhealthy habits. So eating too much, probably drinking too much alcohol, not getting enough exercise, not really taking care of myself. So I think it was difficult too, because sometimes there's a lot of information out there. There's a lot of misinformation out there. And sometimes we don't have the right systems in place to help us to install healthy habits. So it was like a combination of things. And so once I was able to find a system, processes to help me to focus on nutrition, which was the primary thing that I needed to do, was to focus on nutrition and hydration and sleep and managing my emotions. Once I was able to get those habits under control, then I went on to lose 80 pounds in 8 months. And I've been able to maintain the weight loss because once I started to feel better and to get in better shape, I started to increase my fitness levels. I ran a marathon. I'm a runner now. I lead walks. I also, one key part is also having a healthy environment around you and a healthy community. And I've been able to go on to help my mother, who was a diabetic. She was able to lose 60 pounds. She was able to get off her diabetes medicine, help my entire family, and reaching out into my community to help them to also lose weight. So I've now built a very healthy environment around myself.
So it seems to me, Ms. Smith, that when you're 80 pounds overweight, you hear a lot of messages on television and from public health folks that, eat your vegetables and exercise. I guess what you're saying is that kind of pedantic message doesn't get through.
I mean, it gets through, but I think you also need supports. Like coaching is one kind of support that people can get, that the research shows that can be very effective with people because it creates accountability. I think having different systems, that very structured eating program can be very useful. It could be, there are lots of different ones, but you have to really kind of know what you're putting into your body and how much. I think sometimes we're just mindlessly eating. We don't really realize how much we're putting into our bodies. And sometimes we don't know about the portion sizes. And even sometimes with protein, I find that with my clients a lot, they're not even getting enough protein. So it's like a lot of different combinations of things. And you got to make it simple because things get very complicated and then it's very difficult for people to stay consistent.
Ms. Pittman, this sounds a little bit like a middle class recipe, because if I go to a health coach, I'm not certain that insurance pays for health coaches. I'm not certain that I've got enough money to hire a health coach. I'm not even certain I can find a health coach. So if I'm 80 pounds overweight and I'm in that situation, what do I do?
So one of the things that you can do is, really just, like I said, look at the habits of health and figure out what you can do that's easy. You don't necessarily need a health coach to lose weight. There's lots of resources out there. For example, the African American Wellness Project is a resource. There's so many things that you can tune into these days that does not cost money. Social media has a lot of great tips. You can talk to your doctor. You can, like Sharanda said, build a healthy, free community. One of the things that I've done, that Sharanda's also done in her community, is I have a healthy walk on once a week where we get together and we talk about, how we can maintain healthy habits while we're walking. That's free. So there's so many things that you can do day to day. It's really just a matter of learning how to have discipline, consistency, and habits. Those are the key things. If you can keep that up, you can definitely lose weight. But the most important thing is your why. You have to want to lose weight. No one else can want to do it for you. If you don't want to lose the weight, then nothing's going to happen. So that's really the starting point, is looking at your own why and then committing to yourself and figuring out how you're going to get there.
Ms. Smith, you want to chime in?
I also want to say that sometimes we think that things are very expensive when they're not, or not. A lot of my clients that I support, I come from a rural community in Virginia. Many of the folks that I end up coaching are, they don't have college degrees. Some of them may not even have high school degrees. Some people work at Walmart. They work at, service-oriented kind of professions. They may be caregivers to people, elderly people, different types of jobs. And, what they have done is tried to prioritize their health. And sometimes people are spending money on things that are unhealthy things. And so sometimes it's just kind of like reprogramming the way that you think about things. And things that you think might be expensive are actually not that expensive in terms of, like, whether it be a health coach or there are various different programs that are out there that through different kinds of, hospitals and different kinds of programs that exist for folks, even a lot of free classes for even helping with fitness. So I think there are a lot of resources that may not cost that much money. They may not require travel or cost for that kind of thing, but you got to be proactive about it.
And Ms. Pittman, you wanted to talk about?
Just one other thing I was going to add is a lot of companies now are offering so many different programs around health and wellness, and they have programs within the companies, and that's relatively new, I think, since the pandemic. So I would urge people to also look into your company and find out what they have available as well.
Dr. LeNoir, I want to spread this conversation out to a little bit different way. I'm wondering about if we've got a societal issue here, one that is actually exacerbating the obesity epidemic in the United States. Society seems to have gone from fat shaming, which is terrible, to celebrating obesity. So we're now somewhere in between. Are we celebrating obesity in ways that are just unhealthy?
I think what's happened is that, I think it becomes a battle between your self-esteem and your weight. And I think that the message that some people are saying is that, it doesn't matter what my weight is. I am who I am, and I'm okay with that. And I'm going to be the person I'm going to be, and leave me alone about it. I don't think that it's so much a change. I think it's just that I think people who are bigger now have more self-confidence. I mean, if you can sing and you're big, you sing. You can dance and you're big, you dance. Or if you can lecture, or I think that people are more comfortable with weight than they used to be. I think they're more comfortable really with excess weight. I'm not talking about the individual who may be 20% overweight, 25. We see people who are 100 pounds overweight easily. If I go into a restaurant, I can tell you I'm going to see at least 6 or 7 people who are at least 75 to 100 pounds overweight. And I think part of it had to do with the pandemic. I mean, when you sit around for about 2 years and can't go anywhere and cook and eat, I think that's a problem. And once that happens, then I think it's very difficult, I think, for any adult to lose weight. I think what Monique said is, and what Sharenda said are very important. You got to want to do this. And so I do think that there is a little bit more acceptance for weight, not so much as a deterrent to health, but as in just another piece of people who feel more self-confident that their talents are not obstructed by the fact that they're weight. But I can tell you, there's no question, in pediatrics, we're starting to see children who are 75 to 100 pounds overweight who are 14, 13, 14. And like I say, if I go in any restaurant in the Bay Area, I can guarantee you there will be at least 4 people, 5 people who are at least 75 to 100 pounds overweight. So I can't say that that's a trend. It may just be I'm more observant. It also may be that the pandemic was a problem and it's hard to lose that weight. And also now people are more confident.
I'm wondering if, especially in the African American community, I don't know if it's true or not true. Maybe it's just a stereotype that especially Black men like big Black women.
I'll let you handle that one. I don't think that they're unattractive, and they don't think that they're unattractive. And so I think that that's part of it. But I'm not going to get into that. I'm sorry. Some things.
I'm going to let the health coach get into it.
What's that term? Fear to tread?
That's right. From a health coach's point of view, I mean, this has to come up in conversation, right?
Well, one thing I think is a challenge is our institutions and even our family environments. We need to address those, like even churches. It's like churches, sometimes they can be culprits of all the fried chicken and macaroni and cheese and all these different kinds of things. But because a lot of life is centered around food and socialization centered around food. And so I recently went to a church where they had this amazing fitness center, and the first lady was there with us, and doing the exercises. And so they approach it from a whole different perspective. So like even our institutions and then our family functions, like me helping my family has really transformed the way that we eat as a family. And I have one client who, is eating, more low glycemic vegetables, more proteins. Her little 1-year-old daughter eats off her plate. She started eating the red peppers that the mom had on their plate. She runs a daycare, and then all the little children in the daycare are now eating red peppers and more vegetables. So I think sometimes like we can also just kind of look at our institutions, look at our environments in our homes, in our extended families, and see what kind of changes that we can make in that place. And I think that can help a long way with a lot of things.
Monica, there are a number of new drugs that are on the market that were originally put on the market to treat diabetes, but now folks are using it to lose weight. Within your business, have some of your clients said, "Well, how about this or how about that?" What has been your counsel?
Well, I think we've always counseled about like going back to learning the habits, because again, you can do anything to lose weight, but is it going to last? I know so many people who around the time that I had my kids ended up getting a tummy tuck, and because they, had gained weight and they didn't want to actually like work hard to lose the weight. And so they got a tummy tuck, and the fat comes back in different places. So it's really, you can do a lot of different things. You can take the Ozempic shot. You could, do so many different things that are like cosmetic, but unless you learn the habits to keep the weight off, you're just going to gain it back. This is a lifestyle. This is a journey. This is not a sprint. And so, that's the thing that we teach our clients is really just, this is healthy habits for life. And you want to know how you can be optimally healthy through food. Food is medicine.
And as far as these new drugs that are on the market, Dr. LeNoir, these things are relatively new, and I guess that they've been well studied because they've been approved by the Food and Drug Administration. But in your practice, are you beginning to see questions about these drugs, especially when you've got 14-year-olds in your practice who are obese?
Well, there's a big debate now in medicine about whether or not the drugs that are originally designed for prediabetes are better for the general healthcare system if they allow people to lose weight. And I think most people have come out on the side of the fact that the weight is more destructive than the potential of diabetes. And so consequently, using the medicines for weight control has become really quite the thing. The problem is there were so many people using them that you couldn't get them. We're just now starting to see the information that shows that there are some side effects from these drugs. Certainly, after you stop taking them, the weight comes back pretty quickly. The weight can be distributed in different places. You can become hypoglycemic when using the drugs. So that we're just starting to. It was almost like opening up a Pandora's box. I mean, all of a sudden, here's this drug for weight control that seemed to be relatively safe, and now they're going to come out with a tablet. So I think once the tablets come out, it's going to be even more widely distributed. But I think the core of the denominator of the conversations that we're all having is the fact that if you aren't committed, it's not going to happen. For instance, now, I have parents who get, see a child is 14, 15, 16, and they want the shot. And they say, well, we're eating healthy at home. But, then I go to McDonald's because I kind of like fast food every now and then, maybe more now than then. But I see a lot of little children running around McDonald's and Jack in the Box and Chuck E. Cheese and these places. Now, a 4-year-old can't drive to these places. I don't know, there are some YouTube videos where a 4-year-old gets behind the wheel, but the average 4-year-old cannot get in a car and drive to McDonald's. And so parents take them to McDonald's for expediency, sometimes just for, parties. And then they wonder why they have such bad eating habits. And I think these eating habits as a family, as an individual, start very early on. And so if you're listening to the program and you're concerned that your family has this tendency, it's best for you to start with healthy habits as a family, not just for this one child when they're very early on. and then you can expect a better acceptance of good diets. You know, there was just an article that we recently reviewed that said there are 6 foods that will help you lower your heart disease by 20%. They're nuts and legumes and whole fat milk, fruits and vegetables are the usual 6. So that if you start children early, then things may get a lot better. But to go back to the drugs, which is a question you asked me 30 minutes ago, the I come out on the side of the fact that if these drugs work for weight control, and they truly work, I'm all in, because what I see now is epidemic.
Indeed, indeed. And any final thoughts, Ms. Smith, and any final tips for folks who are beginning the journey that you've already been on?
I say focus on your systems, focus on your process, get proper support and accountability, research what may be available through hospitals or your doctor, on your primary care physicians, to see if they actually have suggestions of programs that actually work, and not just say, oh, you need to lose weight, but how, giving people some strategies for how they can do it would be really useful.
And Monique?
I would just say, not counter to what Dr. LeNoir said, but food is medicine. And I would steer people clear of utilizing medicine to lose weight, and look at food and what types of things they can be putting in their body for optimal health. And also looking at how food affects their body. I have rheumatoid arthritis. And so I know when I eat certain foods, immediately my body tells me that was not good for me. So I think looking at food as medicine and really trying to steer clear of any types of drugs.
No, I think a good argument can be made for either case. I think that the people who go into your programs are motivated people. These are people who've committed to losing weight. What I see out here is kind of just catch as catch can. People gaining weight with no particular intention of losing it, and to a certain extent glamorizing it, as just a big bone. That's another one. I love that one. I'm just big bone. Well, you're big bone with a lot around it, so that I think there's a lot of things that we have to do. I mean, you have to be out here and see what I see. I mean, it's just rampant. It's just epidemic. And when you're in an epidemic, just like the COVID-19 epidemic, this one may be even worse. You got to do everything you can to stop it. And so I don't think medicine is the first choice. Obviously not. Dietary change. But, a lot of people, Ms. LeNoir, are not going to toe the line, because that diet, the process that you have, requires a tremendous amount of commitment and motivation. And a lot of people just don't have that in the face of a true burger.
I think what's clearly evident is that this is an extremely serious subject, but also one that is extremely complicated. We've got a lot more on how to lose weight and keep it off on our website at aawellness.com. That's aawellness.com.
That's
Again,
Georgia. That's aawellness.org.
All right. You're right. It's aawellness.org.
Project.org.
That's right. Hey, well, let me back up here, and we'll edit this correctly here.
Okay. Yeah. AA Wellness Project.
So we'll edit here. We've got a lot more on how to lose weight and to keep it off on our website, aawellnessproject.org. That's aawellnessproject, all one word, .org. Again, I'd like to thank Monique Pittman and Sharonda Smith for helping us and being with us, and also Dr. LeNoir for keeping this discussion sort of in the right kind of context. And do you have any final thoughts?
I think that they may want to leave a link for the programs that they're dealing with. Did you want to do that, Sharonda or Monique?
Yes. So are you referring to a website address?
Yeah.
Yes.
Mm-hmm.
Okay. Yes, we can put the links. Can we edit this piece, because we both have to pull up our links? Okay. Because Sharonda, do you have your website link for optimal transformation? Or is that the link you want to use?
I don't have a website. I have a health assessment that I provide to people. And then we have the Be the Dominant Force. I don't know if that's.
Yeah.
we don't really have, people, we do a lot of contact through our Facebook. So people find me through Sharanda Smith on Facebook.
Okay, hold it just a second. George, why don't you just ask them the question and let them answer it, and then we'll finish. Because we'll have to edit at that point anyway.
Right.
I did want to provide, like I have a
Wait,
website
He's
address.
going to ask you the question.
Okay.
As everybody has said, that there's a lot of information out there, and there's not an awful lot of information on our website, aawellnessproject.org. That's aawellnessproject.org. But Monique, you've got a website as well, and I know Sharanda, you've got various ways and various links that people can use to get the kind of information that they need. So Sharanda, why don't you tell us about your links, and then Monique, tell us about your website.
So the best way to find me is through Facebook. My name's Sharanda Smith. You see my name spelled there. You can just look for me. I have a lot of information that I share on my page and in my stories. And then in my profile, I offer free health assessment to people.
Monique?
And the best way to find me is on my LinkedIn. I'm actually on LinkedIn under Monique LeNoir. And also you can find me on my Facebook page under the same name.
And again, always go to the AfricanAmericanWellnessProject.org. Thank you very much for viewing this Wellness Watch and for interacting with us. We really appreciate it. And Dr. LeNoir, any final thoughts?
No, just always the same thought. Health is your biggest asset, so protect it.
Thank you. Now, Dr. Bouchard.